What is the PACT Act? The Promise to Address Comprehensive Toxics Act of 2022 is a new law that expands VA healthcare and benefits for veterans exposed to burn pits and other toxic substances. This law helps us provide generations of veterans and their survivors with the care and benefits they've earned and deserve. When does the law go into effect? While some provisions take effect at different times, VA considers the presumptive conditions established in the PACT Act to be applicable on the date the PACT Act was signed into law, which is August 10, 2022. All veterans and survivors who believe they may be entitled to benefits are encouraged to apply today. What are the PACT Act key components? The Act expands and extends eligibility for VA healthcare for veterans with toxic exposures and veterans of the Vietnam era, Gulf War era, and post-9/11 era. VA will improve the decision-making process for determining what medical conditions will be considered for presumptive status. Every enrolled veteran will receive an initial toxic exposure screening and a follow-up screening every 5 years. Veterans who are not enrolled, but who are eligible to enroll, will have an opportunity to enroll and receive the screening. VA healthcare staff and claims processors will receive toxic exposure-related education and training. The Act requires research studies on mortality of veterans who served in Southwest Asia during the Gulf War, post-9/11 veteran health trends, and veteran cancer rates. The Act will help VA build a stronger, more skilled workforce to meet the growing demand for benefits and services. The Act authorizes 31 new medical facilities across the country, providing greater access to VA healthcare. What are the new healthcare eligibility criteria? The PACT Act helps advance a top VA priority, getting more veterans into VA care by expanding eligibility for and the availability of healthcare services for veterans. The law expands healthcare eligibility to several groups of veterans who may not have been eligible before and requires VA to phase in hospital care, medical services, and nursing home care for any illness to 3 new categories of veterans. Category 1. Veterans who participated in a toxic exposure risk activity as defined by law while serving on active duty for training, or inactive duty training. Category 2. Veterans who were assigned to a duty station in, including airspace above, certain locations during specific periods of time, on or after August 2, 1990, in Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, or the United Arab Emirates, on or after September 11, 2001, in Afghanistan, Djibouti, Egypt, Jordan, Lebanon, Syria, Yemen, Uzbekistan, or any other country determined relevant by VA. Category 3. Veterans who deployed in support of Operation Enduring Freedom, Operation Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, Operation Inherent Resolve, or Resolute Support Mission. What about veterans of the Vietnam War? Presumptions of service connection took effect on August 10, 2022, for veterans who served in the Republic of Vietnam, Thailand at any U.S. or Royal Thai base, Laos, certain provinces in Cambodia, Guam or American Samoa, or their territorial waters, Johnston Atoll, or a ship that called there. This applies for healthcare eligibility and will go into effect immediately for eligible veterans who are terminally ill, homeless, under extreme financial hardship, are over 85 years old, or otherwise can demonstrate sufficient cause. What about veterans who served after the Persian Gulf War? Veterans who served on active duty in a theater of combat operations during a period of war after the Persian Gulf War, or in combat against a hostile force during a period of hostilities after November 11, 1998, and who were discharged between September 11, 2001 and October 1, 2013, may receive care and apply for enrollment for VA healthcare between October 1st, 2022 and October 1st, 2023. Enrollment is free, there are no annual costs, and care may be free as well. What conditions will be presumed to be service-connected? As of August 10, 2022, a long list of new conditions are presumed to be service-connected due to various in-service toxic exposures. Examples include several types of cancer, asthma, emphysema, and chronic obstructive pulmonary disease, or COPD. More information on these conditions can be found at www.va.gov/PACT. If a veteran was previously denied a claim for any of these conditions, what can they do? Veterans previously denied a toxic exposure-related claim are encouraged to file a supplemental claim. Once a supplemental claim is received, VA will review the claim under the new law. What about family members and dependents? Family members or dependents of a deceased veteran may qualify for various VA benefits due to the additional disabilities defined in the PACT Act, if they meet eligibility requirements. Some of those VA benefits include dependency and indemnity compensation, or DIC, accrued benefits, burial benefits. DIC is a monthly payment for the eligible surviving spouse, dependent child or children, or parent or parents of a deceased veteran who died in the line of duty or from a service-connected disability or disabilities. Evidence must show the veteran's death was caused by or related to the veteran's time in service. Accrued benefits are one-time payments to an eligible surviving spouse, dependent child or children, or dependent parent or parents of a deceased veteran based on the relationship when the evidence of record shows benefit, such as disability compensation or veteran's pension, were due but unpaid prior to the veteran's passing. A family member of the deceased veteran may also qualify by providing evidence of payment for the veteran's final expenses or burial. Burial benefits are a flat-rate payment to assist in covering eligible veteran burial in a national cemetery and funeral costs. VA may provide burial benefits to a family member or dependent of a deceased veteran who met the qualifications at the time of their passing. VA pays service-connected burial, non-service-connected burial, plot or interment allowance, and transportation reimbursement. Healthcare through the Civilian Health and Medical Program of the Department of Veterans Affairs, or CHAMP-VA, may also be available for survivors and dependents of veterans who are now, or who would have been, eligible for a service-connected disability. Where can I go to learn more about the PACT Act? At the PACT Act website, va.gov/PACT, you can find the complete list of conditions presumed to be service-connected, plus a wealth of additional information, such as the PACT Act and your VA benefits. What's the PACT Act, and how will it affect my VA benefits and care? What does it mean to have a presumptive condition for toxic exposure? Gulf War era and post-9/11 veteran eligibility, Vietnam-era veteran eligibility, getting benefits, toxic exposure screenings, and information for survivors. We encourage all veterans who believe they may be entitled to benefits to apply now at va.gov/PACT so that your claim can be processed as quickly as possible. If you have questions, call 1-800-MY-VA 411.